What if I told you that one of the most powerful switches affecting your blood pressure is something you've been using every minute of your life, but almost certainly not using correctly? And what if I told you that within the next few minutes, you're going to learn 3 breathing techniques that can calm a stress-driven spike, steady your heart, and help your blood vessels stop acting like they're under attack? I need you to stay with me because technique number 1 is the one most people overlook, and it's the one that can completely change the way your body responds to tension, fear, and those frightening blood pressure readings that seem to come out of nowhere. I'm Dr. Sarah J. Miller, and before we go any further, I need to say something important. Before we begin, please subscribe to this channel, tap the bell, and join our community for simple, life-saving heart guidance. Because what we're talking about today sounds simple, maybe even too simple. But simple does not mean weak. I've spent more than 2 decades in cardiology, and I've seen seniors panic over numbers, reach for extra medication too quickly, or assume their body is failing them, when in reality, their nervous system was in full alarm mode and their breathing was quietly making everything worse. Now, let me be very clear before we start. These techniques are not a replacement for prescribed blood pressure medication, and they are absolutely not the right response to a medical emergency. So if you have chest pain, severe shortness of breath, trouble speaking, weakness on one side, or a blood pressure so high you feel acutely unwell, you need urgent medical care, not a breathing exercise. But if your pressure runs high, if stress sends it even higher, if doctor visits make your numbers jump, or if you feel your body tighten the second you wrap that cuff around your arm, what I'm about to show you can become one of the most useful tools in your daily routine. Here's the part most people never hear explained properly. Blood pressure isn't just about your arteries. It's about your nervous system, your breathing pattern, your muscle tension, your heart rate, and the constant conversation happening between your brain and your blood vessels. Every second of the day. When you're anxious, rushed, startled, angry, or even bracing for bad news, your body shifts into defense mode. Your heart beats harder, your vessels tighten, and your pressure rises. But breathing is unusual because it's one of the only automatic functions you can consciously control. And when you slow it down the right way, you can signal safety to your body and begin reversing that entire cascade. That's why technique number 3 matters so much. I'm starting with this one because it's the fastest to learn, the easiest to remember, and for many people, it's the first time they realize they actually have some control over what their body is doing. Let me tell you about Evelyn, a 72-year-old widow who checked her blood pressure every afternoon right after talking with her insurance company, her pharmacy, or one of her grown children about some family crisis. Every single time, her numbers were higher than usual. She thought she was getting worse. She thought her medications were failing. What was actually happening was far more immediate. She was measuring a stress response, not a stable resting state. Evelyn wasn't imagining anything. Her face would flush, her shoulders would rise, her jaw would tighten, and without realizing it, she'd start taking short little breaths high in her chest. That breathing pattern is a problem because it keeps the body in a guarded state, like you're still preparing for an argument even after the argument is over. Her heart rate stayed elevated. Her blood vessels stayed tighter than they needed to be. And then she'd look at the monitor and see a frightening number, which scared her more, which tightened her even more, which sent the next reading even higher. It became a loop, and the loop wasn't only emotional. It was physiological, measurable, and exhausting. So technique number 3 is this: extended exhale breathing. Not fancy, not complicated, and you do not need to be flexible, spiritual, or experienced to do it. You simply breathe in gently through your nose for a count of 4, and then breathe out slowly through pursed lips for a count of 6 or even 8 if that feels comfortable. That's it. The magic is in the exhale. When the exhale becomes longer than the inhale, you begin nudging the nervous system away from fight or flight and toward rest and digest. You are telling your body in a language it understands immediately that the threat has passed. And for a lot of people, that is the first moment their blood pressure starts to soften. When I taught Evelyn that pattern, I told her not to force huge breaths. That's where people go wrong. They think deeper always means better, so they inhale too much, too hard, too dramatically, and then they feel lightheaded and decide breathing exercises don't work for them. No, what works is gentle control. Quiet inhale, longer, softer exhale, lips slightly pursed like you're cooling a spoonful of soup or blowing out a candle without letting wax splatter everywhere. She practiced 5 cycles before checking her pressure and 5 cycles anytime she felt herself getting wound up. Within a week, she told me something beautiful. For the first time, she said, I can feel my body coming back down. And that phrase, coming back down, is exactly what technique number 3 is for. It is the rescue technique, the in-the-moment technique, the I can feel myself climbing technique. If you've just read a stressful text, had a tense conversation, watched the news, argued with a family member, or sat in the parking lot before a doctor's appointment feeling your pulse in your throat, this is the one you use first. 4 in, 6 or 8 out, 6 to 10 rounds. No strain, no breath holding if that feels uncomfortable. Just lengthen the exhale. And if you're one of those people who says, Doctor, I can't meditate, good. You don't need meditation to do this. You need 1 quiet inhale and 1 even quieter exhale. But technique number 3, as powerful as it is still not the one I would choose if you told me, Dr. Miller, I want to train my body to lower my pressure more reliably over time. For that, we need to move to technique number 2, and this one changes not only how fast you breathe, but where the breath goes. Let me tell you about Walter, 76 years old, retired mechanic, strong hands, strong opinions, and one of the most tense breathers I have ever met. He told me he was doing deep breathing every day, yet his neck felt tight, his shoulders hurt, and after every session he felt more wound up than relaxed. I asked him to show me what he meant by deep breathing. Walter sat in the chair, puffed his chest up like a soldier standing inspection, lifted both shoulders toward his ears, and sucked in air as if he were trying to inflate his collarbones. Then he blew it out hard and fast. That was his version of relaxing. But the body doesn't experience that as relaxation. Chest-dominant breathing often recruits the accessory muscles of the neck and upper chest, which means you can end up increasing tension while trying to get rid of it. Walter was working at breathing. He wasn't resting into it. And because he was staying tight through his chest and shoulders, his body never fully got the message that it was safe to ease off the gas. Technique number 2 is diaphragmatic breathing, sometimes called belly breathing, and I want you to listen carefully because this one sounds easy until you try it. You place one hand lightly on your chest and the other just above your navel. Then you inhale through your nose slowly enough that the lower hand rises first, while the hand on your chest stays mostly quiet. That tells you the diaphragm is doing the work. Then you exhale slowly through your mouth or through lightly pursed lips and feel the belly gently fall. No forcing. No sucking your stomach inward on the inhale. No dramatic chest expansion. The movement should be lower, softer, and calmer than most people expect. Why does this matter so much? Because when the diaphragm engages properly, the entire breathing pattern becomes more efficient and more calming. You are no longer taking shallow upper chest breaths that keep the body on alert. You are using the big muscle designed for breathing. That helps slow the heart rate, reduce unnecessary muscle tension, and support the body's relaxation response. It's one of the reasons people often say, I didn't realize how tense I was until I finally breathed this way. Walter practiced it lying on his back at first, because that position made it easier to feel the abdomen rise. Within days, his shoulders stopped jumping every time he inhaled, and his sessions finally started calming him. Now here's where people sabotage technique number 2. They rush it, they turn it into a performance, or they keep checking whether they're doing it perfectly every 2 seconds, which makes them more anxious. So let me simplify it. Think balloon, not vacuum. When you breathe in, imagine a balloon gently expanding below your ribs. When you breathe out, imagine that balloon softening back down. If it helps, place your tongue lightly on the roof of your mouth and keep your jaw loose. Unclench your hands. Drop your shoulders. If your chest still keeps taking over, try practicing while lying flat with a light book on your abdomen and see if you can make the book rise without shrugging your shoulders. Walter did that every morning and every evening for about 10 minutes. Not all day, not every time he remembered, just twice a day, consistently, and the first big change wasn't his numbers. It was his awareness. He began noticing how often he held his breath during the day, especially when he was concentrating, scrolling on his phone, or feeling irritated. That matters because breath holding and shallow chest breathing can quietly keep the nervous system activated for hours. Once he learned diaphragmatic breathing, he had a way to interrupt that pattern. And after a few weeks, yes, his blood pressure log began looking steadier too. Not magically cured, steadier, calmer, less reactive. That's a huge win. This is what I want you to understand about technique number 2. It is not just something you do for 10 minutes and forget. It retrains your default, it teaches your body what a calmer breathing pattern feels like, so that during ordinary life, when you're paying bills, watching television, waiting in line, or lying in bed at night, you are less likely to slip into that tight, shallow, guarded style that keeps pressure elevated. If technique number 3 is your emergency brake, technique number 2 is your posture correction for the nervous system. It changes the foundation. And once that foundation changes, technique number 1 becomes dramatically more effective. Because technique number 1 is the one that brings everything together. Pace, rhythm, and nervous system balance in a way that can feel almost startling when you first do it correctly. Let me tell you about Lorraine, 69, who would wake up every morning with one thought already waiting for her. I hope my blood pressure isn't high today. And the second that thought appeared, her body was already bracing. She would walk to the kitchen, sit down, wrap the cuff around her arm, stare at the monitor, and feel dread before it even started inflating. Her readings were often highest in the morning, and she was convinced something terrible was building overnight. But the bigger problem was not just the reading, it was the fear surrounding the reading. Lorraine's morning pattern is incredibly common. Blood pressure often rises in the morning as the body wakes up. Cortisol increases, and the day begins. But when you add fear, anticipation, and a hurried breathing pattern on top of that normal morning shift, you can create numbers that are far more reflective of nervous system alarm than of stable cardiovascular control. Lorraine needed something stronger than generic advice to just relax. People hate hearing that. It feels dismissive. What she needed was a precise, repeatable breathing rhythm that could anchor her body before her mind ran away with the story. And that is why technique number 1 is my favorite for people who want structure, consistency, and measurable calm. Technique number 1 is slow rhythm breathing at about 6 breaths per minute. That sounds technical, but it's actually very simple. You inhale gently for 5 seconds and exhale gently for 5 seconds. In for 5, out for 5, no force. No giant breath, no breath holding. Just an even, smooth rhythm that brings you to roughly 6 full breaths each minute. There's a reason this technique stands above the others. For many people, this pace seems to hit a sweet spot where breathing, heart rhythm, and the body's pressure sensors start coordinating more efficiently. In plain English, it helps the cardiovascular system stop behaving like an orchestra with every section playing a different song. When Lorraine first tried it, she said it felt too slow. That's another common reaction, People who live in a subtly activated state often don't realize how fast they normally breathe until a calmer pace feels unfamiliar. So I told her not to chase perfection. If 5 and 5 felt too slow on day 1, start with 4 seconds in and 4 seconds out, then gradually lengthen. The goal is not suffering through a timer. The goal is smoothness. You want the inhale to arrive quietly, the exhale to leave quietly, and the body to stop feeling rushed. Some people like a ticking clock, some use a finger tap. Some silently think in 2, 3, 4, 5 out, 2, 3, 4, 5. And here is the critical rule for technique number 1. Never turn it into overbreathing. If you start taking giant gulps of air just to match the count, you'll blow off too much carbon dioxide, feel dizzy, and assume the exercise is wrong for you. The breath should be smaller and softer than you think. Gentle 5-second inhale. Gentle 5-second exhale. If you feel short of breath, shorten the count. If you feel air hunger, shorten the count. If you have significant lung disease or serious cardiac symptoms, talk with your clinician before pushing any breathing routine. This is supposed to feel settling, not punishing. Your body should feel more organized after 2 minutes, not more distressed. Lorraine practiced slow rhythm breathing for 5 minutes before checking her pressure and another 10 minutes later in the evening. Within days, she noticed the first shift, and it wasn't the number on the screen. It was that she no longer felt ambushed by the cuff. Her hands were less cold. Her shoulders were down. Her jaw wasn't locked. And when your body stops rehearsing disaster, the blood pressure reading you get is often closer to the truth. Over time, her numbers became less erratic, but just as important, her fear became less controlling. She stopped treating every elevated reading like a prophecy. She started seeing patterns instead of catastrophes. That emotional change matters more than most people realize. Now I want to address something very important, because this is where people either get empowered or they accidentally fool themselves. Breathing techniques can help reduce stress-driven elevation and support lower blood pressure over time. But they are not a trick for hiding uncontrolled hypertension. Don't use them to game the reading and then tell yourself everything is fine. Use them to calm your system, to train your system, and to create more accurate, more consistent conditions for measurement. If your numbers remain elevated despite calm, proper technique, medication adherence, and repeat checks, that is useful information. We do not want to erase the signal. We want to reduce the noise around the signal so you and your doctor can make better decisions. This matters because a lot of people do one breathing session, see a nice drop, and decide they've solved the problem forever. No, that's not how physiology works. What breathing gives you is influence, not immunity. It gives you a lever you can pull whenever stress is amplifying the problem. It gives you a daily practice that may help bring modest reductions over time. It helps slow the heart, reduce reactivity, and improve how the body handles pressure surges. But if you're eating poorly, sleeping 4 hours, skipping medication, living under constant stress, and never moving your body, breathing alone is not going to clean up that entire mess. It's powerful, yes. It is not magic. So let me make this practical. If you want the fastest calming effect in the middle of a stressful moment, use technique number 3, the long exhale. 4 in, 6 or 8 out. If you want to retrain shallow upper chest breathing and build a calmer baseline, use technique number 2, diaphragmatic breathing. 1 hand on chest, 1 on belly, breathe so the belly rises first. And if you want the most structured, rhythm-based practice for daily nervous system regulation, use technique number 1, slow breathing at around 6 breaths per minute. 5 seconds in, 5 seconds out. These techniques are not competitors. They are tools for different moments, and together they create a very strong routine. Here's the routine I teach many of my patients. In the morning, before breakfast, or before your blood pressure check, sit comfortably with both feet on the floor. Close your eyes if that helps. Start with 2 rounds of diaphragmatic breathing just to settle into the body. Then move into 5 minutes of slow rhythm breathing at 5 seconds in and 5 seconds out. If you're still feeling tense, finish with 3 extended exhales, 4 in and 8 out. Then take your reading, ideally after a few quiet minutes, not while talking, not after rushing around, and not with your mind racing through the day's worst possibilities. That little sequence can change the entire emotional tone of your morning. In the afternoon, if something spikes you, and something always seems to, don't wait until you're already fully flooded to remember your breath. Use technique number 3 the moment you notice the climb. Notice your shoulders rising. Notice your thoughts speeding up. Notice your chest tightening. That is your cue. 4 in, 6 or 8 out. You're not trying to become a monk. You're interrupting escalation. Even 6 slow rounds can keep a stressful moment from turning into a full physiologic storm. And if you're in the grocery store, in the car, on the phone, or sitting in a waiting room, nobody even needs to know you're doing it. That's one of the reasons it's so useful. In the evening, this is where technique number 2 becomes incredibly valuable. So many people carry the whole day in their upper chest. They don't realize their breathing has been shallow for hours. They sit down to rest, but their body never truly shifts out of vigilance. So lie back or sit in a supportive chair, put one hand on the chest and one on the abdomen, and breathe low and slow for 10 minutes. Let the belly rise gently. Let the face soften. Let the exhale fall out of you rather than be pushed. Done consistently, this can improve sleep quality for some people, reduce that bedtime sense of internal buzzing, and lower the baseline tension that feeds into morning blood pressure readings. And if you're telling yourself right now, "This sounds nice, doctor, but I've tried breathing exercises before and I got bored." I hear that all the time. Boredom is not failure. It's often just the moment when your brain realizes there's no emergency to chase. We've become so used to stimulation, noise, news alerts, and constant internal commentary that calm can feel strangely unproductive at first. Stay with it. You don't need to enjoy every second for it to work. You need repetition. Think of these techniques the way you would think of brushing your teeth. Not thrilling, not dramatic. But if you do it every day, the long-term difference is enormous. I also want to say something specifically for viewers over 60 because your body may respond differently than it did when you were 35. You may get dizzy more easily if you breathe too forcefully. You may have arthritis, shoulder tension, back pain, or chronic lung issues that make certain positions uncomfortable. That does not mean breathing techniques are off the table. It means you need to be gentler, slower, and smarter. Use a supportive chair. Keep your breaths comfortable. Shorten the count if needed. If holding the breath makes you uneasy, skip breath holds entirely. If lying flat bothers you, sit upright. The goal is not to win a breathing contest. The goal is to help your cardiovascular system feel safe enough to stop overreacting. There's another mistake I need to protect you from, and it's subtle. Some people become so focused on the blood pressure number dropping that they start monitoring every sensation during the breathing session itself. Is it working yet? Is my pressure lower yet? Why do I still feel my heartbeat? Maybe I'm doing it wrong. That kind of internal surveillance can keep the nervous system activated. Instead, measure success by how your body feels first. Is your jaw less tight? Are your shoulders lower? Is your forehead softer? Is the breath quieter? Is your pulse less pounding? Those are signs the system is shifting. The number often follows, but if you obsess over the number too soon, you can sabotage the calm you're trying to create. Let me tell you about Frank, because his story ties everything together. Frank was 74, former truck driver, tough as nails, not the type to use what he called fancy relaxation nonsense. His blood pressure would spike every time he argued with his son. After one family fight, he sat down and got a reading so high he nearly drove himself straight to the emergency room. He was frightened, angry, and breathing like he had just run up a hill. When I taught him the long exhale, he rolled his eyes. When I taught him belly breathing, he said it felt silly. When I gave him the 5 in, 5 out rhythm, he said, "Fine, but this better do something." 2 weeks later, he came back and said, "I hate that this works." And honestly, I love that, because what he meant was not that he had become a different person or that life had stopped being stressful. He meant that he finally had a tool between stimulus and reaction. Before, stress went straight into his body, straight into his blood vessels, straight into the monitor. Now there was a pause. He used long exhale breathing during arguments. He used belly breathing at night because it helped him stop carrying tension in his chest. And every morning he used the 5 in 5 rhythm before taking his pressure. His readings became more stable, and more importantly, so did he. That phrase matters. So did he. Because blood pressure is not just a number on a machine. It's a reflection of how hard your cardiovascular system is working against the conditions you give it every day. When your breathing is rushed, shallow, tight, or chaotic, you're feeding the very system you're trying to calm. When your breathing becomes slower, lower, and longer on the exhale, you create a different internal climate. Not perfection, not a guarantee. A different climate, and in that climate, the heart often beats with less strain. The vessels resist less, and your mind stops interpreting every sensation as a warning siren. That is not small. That is life-changing. So let me give you the full protocol one more time, clearly, because I want you to be able to use it today without replaying this video 3 times. Technique number 3, extended exhale breathing. Inhale through the nose for 4, exhale through pursed lips for 6 to 8. Repeat 6 to 10 rounds during stress spikes. Technique number 2, diaphragmatic breathing. 1 hand on chest, 1 on belly. Breathe so the belly rises and falls while the chest stays mostly quiet. Practice 10 minutes once or twice daily. Technique number 1, slow rhythm breathing. Inhale 5 seconds, exhale 5 seconds, about 6 breaths per minute. Practice 5 to 15 minutes a day. Gentle breaths, no straining, no over-breathing. And if you're wondering how long it takes to notice a difference, the answer depends on what kind of difference you mean. Some people feel calmer within 1 minute. Some notice a lower pulse almost immediately. Some see their blood pressure readings soften after a single well-timed session. But the deeper benefit, the one that matters most, usually comes with consistency. Days, weeks, repetition. Training the body to stop living on the edge of alarm. That's where real change happens. Not in one heroic breathing session. In the quiet daily practice nobody applauds. The same way you protect your heart with walking, sleep, medication, and better food, you can protect it with the way you breathe. I also need to remind you of something compassionate but firm. If your blood pressure remains high, do not feel like you failed because breathing didn't fix everything. High blood pressure can be driven by genetics, kidney issues, sleep apnea, arterial stiffness, medication interactions, excess sodium, weight gain, inactivity, pain, and many other factors. Breathing is one piece of a larger strategy, a valuable piece, an underused piece, but still one piece. Use it alongside proper medical care, not instead of it. If this video helped you, if you felt your shoulders drop even while listening, or if you know someone who gets scared every time they see a blood pressure number on a screen, share this with them. Because sometimes the most helpful medical tools are not louder, bigger, or more expensive. Sometimes they are quieter, sometimes they've been with you all along, and sometimes what changes a person's health is not one dramatic breakthrough, but one calm practice repeated often enough that the body finally believes it is safe. Take care of your heart, take care of your breath, and I'll see you in the next video.